great research, but there also are medical education ones, but they're less common. Essentially, it allows you 4 months of dedicated research time. I put in the bullet points on the side of my slide the 5 things that my personal programs say that I need to do. So I need to do a project. I need to learn about the ethics of critically unwell adults because I'm on the neurointensive care unit. I need to acquire new skills, whatever that might be. I need to present at least one conference, and I need to participate in departmental meetings. So there are things that are expected of you. But one thing that I really want to stress is you have 4 months of research, but you have 20 months of being a foundation doctor. So make sure you pick the right deanery for you, and the right other rotations for you, because that's what you spend most of your time living as. One other thing to mention is not all the AFPs do the 4-month block thing. Some do like flexible research time. So you'll get like 1 day a week, maybe a Friday dedicated to research, and you'll get that throughout your program, but they're less common, and I didn't apply for any of them. One thing that you should have in your repertoire is knowledge of the NIHR integrated academic training pathway. So that's what this sort of flow diagram shows. It's why the academic foundation program was created, and it sounds really nice if you word that into your career plans, if that applies to you. So the idea is that from medical school, you can apply to the academic foundation, which puts you on the step ladder, and then it puts you in a better position to apply for academic clinical fellowships and then lectureships. But give that a Google, because they can ask you about it. So choosing where or if to apply, the AFP sounds fantastic and you lose nothing by applying, but it is a lot of stress. I was really losing my nut in kind of November time when none of my colleagues in F year were actually stressed, but I was going through applications and interviews, and it does take its toll, because that's about the time that you're prepping for your SJT if you're the December sitting as well. There's a risk that you might not be successful and you might get sad in January. There's less time to learn how to be a good doctor, so I have 4 months less than my colleagues to practice doing cannulas and doing on-calls, stuff that you need to do. You can't link your applications, so if you have a significant other or just a really close friend, you can't pair up. And actually you get a really significant pay cut, so you get about £2,000 to £3,000 less by doing an academic block, because where the money comes as an F1 isn't in your basic pay, which is the 28,000, it's in your extra money that you get for your nights and your unsociable hours, which on general surgery, which I'm doing at the moment, is brilliant. Anyway, the positives of it, it obviously looks really good on your CV. It is that first step along the academic pathway, and you have dedicated time to building your CV. Working life is hard, and trying to motivate yourself to do CV building at 9 p.m. when you get back from a 12-hour on-call is tough. It gets you direct exposure to academia through sort of minimal effort. And you can choose a specific specialty. So most AFPs, they are in something like neurosciences or renal or cardio. And that really looks like you're gearing your CV towards some kind of destination. Yeah, it gives you the chance to develop transferable skills, you've got to say that. But also it's really, really helpful for finals. Preparing for these academic foundation program interviews was probably the most helpful thing I did in terms of final preps. Not that I got to do an OSCE in the end, but had I done an OSCE, the acute medicine station is very akin to the prep that you should be doing for a clinical interview station for an AFP. And you find out your rotations early, which is really nice. So choosing where to apply, the technical stuff is that you pick 2 academic units of application. These are like your deaneries, but they're not the same as normal deaneries, which aren't the same as counties. Just look it up on Oriel, which will become your best friend if you haven't got used to it already, and the UK FPO website. Actually read the prospectus of the academic units of application that you're applying to. That will tell you stuff that you need to know, like whether the AFP that you're applying to gives you a block of time or that flexi 1 day a week. It will tell you what specialties are available in that academic unit of application. which is important if you definitely know you want to do research into one area, or you definitely don't want to do research and you want to do medical education. Some academic units of application, I think Oxford, but I didn't apply there, so I'm not 100% sure, let you kind of choose your own project and sort of overarching title of your AFP. So you just get given an academic foundation program job and then you organise your project later, but that's less common again. And also think about where you want to be and where you want to work. I thought I loved London, living in London, but now I love the countryside. People are so friendly, and it really makes a difference. So think about where you want to work, because again, for 20 months of your 24 months, you're going to be working in these hospitals. Think about if you want 2 years at the same hospital, or you really want to be in a DGH for your first year, which is, in my opinion, where you want to be. Also, think about the application process. So I probably should have said I applied to London and I applied to Cambridge, which is in East Anglia, academic unit of application. The London application, which I was successful for, is very points mean prizes, is the way that I describe it. It's very impersonal. You're just kind of ranked. There's no real thought for who you are as a person and what you want to research. And that kind of, I think, may reflect that programs there. Whereas Cambridge, intimidating as it was a more personal field to the application. I did white spaces where I had an opportunity to try and share who I am as a person. And then the interview was a small panel interview, which was intense. But I actually got to share anecdotes and show them that I'm a real person. And I ended up choosing Cambridge because that's more me. Try and talk to the people who are in programs. So I've got my contact details on the last slide. I really don't mind if you message me. I won't message back if I'm at work, but I will when I'm at home. And there's this debate whether you, within your academic units of application, which you can only pick 2, there's a debate as to how many programs within that you rank. So some people say rank all the AFPs in your unit of application because that gives you the maximal chance of getting given one. But then I say only pick or rank the ones that you would accept, because otherwise, what's the point? But I'll let you choose where you stand on that. So the application process, the way to succeed is to get a diary or use the diary on your phone. I've print screened your guys' key dates and UK FPO timeline. If you're in final year this year, actually write down when these dates are. You don't want to be that person that's forgotten that their applications are due in one day and you haven't actually prepped yours. You don't want to be the person that doesn't know they need to take time off placement for an interview. You don't want to be the person that's like, oh, I didn't get an email. Is it off a day? You kind of want to know. And think about which application process arm you would like to go down, the points mean prizes or the white space questions. But I would say for both, now's about the right time to start preparing. So I'll talk about points mean prizes, which is what I call the London application process. You've probably heard most of this before, but this is my 1 minute summary. So what London do is you apply to them, you rank X number of AFPs, and then they long list a certain number of candidates. So you should be, or will very soon be, familiar with the UK FPO scoring system. So you get 43 out of a possible 50 points for being in first decile, 42 for being in second, and so on and so on. London pick a decile score that normally ranges between 39 and 42. And if you're above that, you reach their long list. If you're on their long list, they actually read your application and they grade your application out of 25. You can get a maximum of 10 points for degrees. So I got 4 for my first class BSc. It's quite, in my opinion, biased against JEPs. They often score really highly in this. But then undergrads can claim back some points with publications and posters. So you can get max 10 points for that. As I said, they don't accept being a collaborator. They don't accept non-PubMed ID journals. But if in doubt, put it down, because I don't know who the people that grade these applications are, but they do weird and wonderful things. And I got points for things I wouldn't, and didn't get points for things that I was certain I would get points for. And likewise, you can get 5 points for prizes, distinctions, and merits. What they define those as, I really don't know, and there really isn't any information like this out on the internet, or if there was, I couldn't find it. Just put down everything that you've got. Then they give you an interview score, I assume out of 25, and they put together your pre-interview and interview score. And then, as the UK FPO do, the first person gets their top choice, second, blah, or second first if it's still available, blah, blah, blah. Oh, I've seen some comments. I'll answer them at the end because I'm like too scared to click on the comments in case my PowerPoint goes, because I've been scarred by my M&M experiences today, if that's all right with you guys. My top tips are: check before you apply to journals, if you're applying to journals at the moment, that they do have a PubMed ID number. Get started early, but if that's too late for you guys now, letters to editors are a great quick fix for points. Use pieces of work that you've already done. So if you've done an SSCT, why haven't you published that? Why haven't you applied it to a poster? Why haven't you generated other outcomes from it? And have at least 5 things on the go at once. This is both my strong point and my nemesis, but not all projects hatch and get outcomes. That's just part of life. And one thing that I've learned that I've never actually put into action is you don't actually have to be at a conference presenting it to get the point for it. If your name is on the poster and someone else presents it, you still get a point, apparently. Okay, white space questions. Look them up now. This is where you get given, for Cambridge it was 6 questions. I'll go through them in a minute. And you get about 200 to 225 words to sell yourself. It's not very much, so you do not have time to waffle or space to waffle. GCSE English, they tell you to pee all over your work, or they told me that. It would sound weird if they didn't tell you guys that, but that stands for point, evidence, explain. So if they ask you a question, answer it. Evidence is outcomes that you've got. So I did a BSc and then I got it published. And then explain is going on to show the skills that you've gained from that. So I learned how to lead a study, how to write up academic literature. I learned how to do stats on SPSS. Revise your own CV, like actually print out your CV or write one if you haven't got one, and tick it off. Make sure that everything that is on your CV is in these white space questions, because if it's not written down, they won't know. And big yourself up. It's a real acquired skill to sell yourself. Don't be arrogant, and don't think that they will just give you an AFP because you think you're great. You need to show them that you're great, and you really need to back yourself because no one else will. Okay, so these are the 6 questions that I answered for Cambridge last year. They're all to do with your career plans and how your plans match up with our programme. What are your best achievements? Team working, leadership often comes up. Cambridge always have a whack question. So my off-the-wall question was, give an example of an unanswered high priority challenge in medicine. That was a difficult one. And the rest are along the same lines. So I would ask that no one directly copies what I've written, but I'm happy to show you guys 2 of my white space questions from last year. So I'm going to show you my answer to the first question. So the question is, what are your specific reasons for applying to the Cambridge Academic Foundation programme? Please highlight how the programme will contribute to your clinical or research career plans and outline these. So this is my max 225 word response. What I've done for you guys is I've underlined where I think I'm answering the question. So I'm telling them what my career plans are and how I think that Cambridge will help me. And I've put in red and bold my sort of evidence. So things that outcomes that are on my CV that I want the reviewer to know about. So I'll let you guys pause to read that for a second. please don't judge me. It's quite a scary thing to like put these answers out there in front of everyone. If like Shahi, I can see your face, can you give me a wave when you think it's like an appropriate amount of time when people have read it? Yeah, we can come back to it if you guys want, but it's more just to give you a flavour of point, evidence, explain, rather than you sort of copying the outcomes that I have. Okay, so this is the next one. So this is, what is your single best clinical or research achievement, paper, presentation or prize, and why? Only give them one answer if they ask for one. So I picked my scholarship that I got to the USA because I could be cheeky and be like, oh, this is what led to my publication and this was part of my BSc, so I could sort of fudge that a little bit. But if you say 5 things, you're not answering the question and they won't have any respect for that. Why I've shown you this answer is because it includes a lot of skills, if I say so myself, that I managed to list off and demonstrate that through this achievement I have demonstrated. So study design, leadership, data collection. I've also listed some ones that are more unique to me, like the ethical use of human tissue, because I did a neuropathology project, communication, teamwork, time management, those kind of things. And then you scatter it with prizes and stuff that you've won. But that's kind of how I approached the white space questions, but just sit down and it will take you ages. Okay, interviews. You've done all of that. You've got 2 different interviews to prepare for. How do you prepare for it? You can't practice on your own for an interview. I found a buddy. She was a fellow final year with me, and I didn't know her very well, and I think that actually benefited me because I was sort of more scared and I didn't want to embarrass myself in front of her when we were practicing, so it kind of made it a little bit more realistic than if I was with my best mate and we were just joking around. We did mock interviews for each other in the style of London because that was our common application. We did mock interviews every week from about September, so now until the interviews, and we tried to do them in person or over Zoom when we were both off in placement in different places, and really give each other constructive criticism. But that's what I found useful. Again, revise your own CV. And revise your white space questions, because that's what the interviewer, if it's a panel interview like Cambridge, is going to have in front of them. So if you can't remember what you wrote, you look pretty stupid. And also, this is something that you should do before you write your white space, is SWOT up on your chosen academic unit of application. I would say you don't have to go as far as picking your project that you want to do, but have an idea of a supervisor or some of the research that they're doing or the types of research they're doing that you sort of think you could fit in with. Okay, so the academic station. Most interviews are broken up into an academic and a clinical station. So for example, London, we had 25 minutes to prepare an abstract and the clinical scenario that we were given, and then we had 2 10-minute stations for the 2 academic and clinical, whereas Cambridge was a 30 minutes panel interview, no time to prepare really, no paper to analyse. It was mostly personal questions interjected with a random clinical one that really caught me off guard. So you don't have to give perfect answers even. They told me that out the blue a child was seizing, what would I do? And I forgot that febrile seizures were a thing because I hadn't revised peds yet. Not that that's an excuse, but because I was thorough and I escalated, hopefully I passed. But the academic station also encompasses personal questions in London. So these 2 books that I've put on the screen are the ones that I absolutely swear by. So the medical interviews book, it gives you a really good flavour of the types of personal questions that they could ask you at interview. I worked through the whole book. And by working through them, I got used to selling myself. I got used to sort of learning which skills I could drop in where, which sort of achievements I could drop in where. And then the Doctor's Guide to Critical Appraisal is fantastic for the academic station. I'll kind of take you, I would just learn that word for word essentially, but I'll take you through my prep for an academic station. So when I was given an abstract before my London interview, I obviously read it, I highlighted it, but then I made my own notes on a blank piece of A4. At the top, I would write a one-liner saying, this is a, for example, double-blind, multi-center, randomized controlled trial comparing X and Y. Primary and secondary outcomes were, it shows this, and it's generalizable because. And that just helps you when you're really nervous and the interviewer says, so tell me about this paper, then you can essentially read that off and kickstart yourself. I would do a quick PICO, so population, intervention, comparison, outcome. But actually making note of things like the inclusion-exclusion criteria, the size, blinding, what type of study is it, placebos. A priori is something that I learned for AFP, so that's if they lay out their outcomes before they do the study rather than just working out some outcomes after the fact to make it statistically significant, which is a bit shady, and learn your stats and learn what stats you should be applying where. Also, I would break it down into the positives and negatives of the study in terms of both internal and external validity. So internal validity is how well your study answers the question that it sets out to answer. So are there massive confounders in the way, or are there so many biases that it's kind of useless? And what about its external validity? So yeah, you got a fantastic, significant result in this small population, but is that the same as the overall population? Can we generalize it at all? Remember your pyramid of evidence as well. One study is never enough. You always need to say that, but if it's a systematic review, it's better than a case study written by a medical student who didn't know what they were talking about. And it's not appropriate for all abstracts, but have a think about the ethics, because they do like to try and trick you with an ethical question. But I'm not going to dwell, because I can't do better than a textbook in sort of explaining how to analyse an abstract. What I will go over now quickly is the clinical station. So this is the bit that really prepares you for being a real F1. It's showing that you're safe. What an F1 does when they're on call is do ATEs on people, and they need to know when to escalate. And that's about it, really. And that's scary enough, trust me. So the Oxford Handbook of Clinical Medicine, the medical emergencies at the back, it is not a comprehensive list, but this is the only useful thing that you will learn at medical school. And make sure that reading those pages does not shock you. Be able just to tell the examiner how you'd manage an upper GI bleed, for example. So the way that London do their clinical station, and it won't be too different at other places, is they give you a scenario. So I've written this one myself based on a traumatic set of nights I had the other day. So you're an F1 on call for general surgery. That was me. You're in the middle of writing a VTE assessment for a new patient, which you always are when you get bleeped to see 3 other patients. So the information that they will kind of give you is there's a 65-year-old being treated for acute gout who has coffee ground vomit. That should be ringing alarm bells. An 88-year-old with a background of a coronary artery bypass graft who's now having chest pain. And a 74-year-old who's post-total hip replacement who has a distended abdomen and hasn't pooed for 4 days. And then what you need to do is you need to talk the examiner through how you would respond. So you need to go see these patients, but you're not superhuman. You can't see them all at once. So you need to triage. But you can't triage on the information that you have. So you need an SVAR handover from the nursing staff who are bleeping you about all of these patients. You need to know the observations of these patients and the trends in the obs. Because, for example, the patient number 1, who we think is having an upper GI bleed, is completely hemodynamically stable. So you can tell the nurses not to give the colchicine dose for this evening and bleep you if there's any change, but you'll be there as soon as possible. The 88-year-old with a background of heart issues with chest pain, you can say, are they stable? Have they had any bloods done? Is there a recent trot? Could you do an ECG for me before I get there? Is there anyone on the ward who can take bloods for me while I get there? Because patient 3 might have SATs of 74%, they're in fulminant pulmonary edema they were, and they were septic and third spacing. So they would be the priority. The way I prioritize is A to E. So patient 3, although you don't get it from the little abstract title one-liner, they have a breathing problem. So I would always prioritize breathing problems over circulation problems over disability. So as I've kind of tried to demonstrate to you, you need to make a decision. So I would probably go 3, 2, 1 in my order that I would see these patients. I would explain how I'm prioritising that to the examiner. I'd explain the sort of temporary holding measures that I can get the nursing staff or anyone on the ward to do in the meantime. And then I'm going to make my way to go see a patient. So on my way to patient number 3, I'm thinking about causes of distended or acute abdomens. I'm thinking about GI causes. I'm thinking, could this be, I don't know, ileus? Could it be obstruction? Could it be ascites? Who knows? And I'll talk the examiner through that. And then you talk your examiner through your A to E. Don't just say I would do an A to E, because they don't know you from Adam. They don't know that you even know what the letters stand for. The way I think of A to E is examine, investigate, treat for each one. Reassess always. And always use your other staff members, because that makes you sound nice. Okay, I will stop rambling about my traumatic patients from my night shift. I think that's almost it. Just to go through the realities of being an AFP. The realities is I haven't been able to meet my AFP supervisor yet because of COVID. I'm having a Zoom call with them in a few weeks. The realities are I'm almost a normal foundation doctor at the moment. I am a slave to my Horus e-portfolio, so you still have to get DOPS signed off. I have to have bloods signed off by a senior. I'm a slave to my rota. I don't have too much of a life outside my rota. I have a lot of paperwork to be doing and a lot of extra paperwork to be doing as an AFP, because you need to be doing reading up on your supervisors to try and suggest a project to these very clever people who've taken you under their wing. And when you are on call, you are the first link in the chain of survival. It is your job to identify early patients that are going to deteriorate, and it is your job to call for help. Some people that they don't tell you about at medical school that are my best friends in the hospital are outreach. So at my hospital, critical care outreach are a bunch of highly trained nurses, and they will come and help you assess really unwell patients. But this is basically what my life is like at the moment. It is a surgical ward round where everyone is walking off, and I don't quite know what the plan is. Thank you very much for listening to me ramble. Here are my contact details. I really don't mind if you email me. There's no such thing as a stupid question, or even WhatsApp me. I won't reply straight away, but I will reply. And if I can't help you, I'll try and direct you towards someone who can. So thanks, guys. I will stop sharing my screen. There we go.
Thank you so much, Emma, for a really, really helpful session. I know I found that quite helpful, and really kind of you to include your answers as well, because as you said, that I can imagine that's quite nerve-wracking. So thanks, really, really helpful. I'm just going to post the link for the student queue, which is just the website to ask questions other than in a bit. But also a feedback form for Emma. Please fill it out, because this is useful for her. As you see, feedback is super important for applications in the future, but it's also helpful for you because you can get some prizes and like year's subscription to Osmosis and that kind of stuff. So not year, but some kind of subscription to Osmosis. So yeah, I just recommend you do it. So here's the link for that. And then we'll hand over just to answer some questions. So Emma, it's up to you how you want it. I can read out the questions, or you can read them if you want to, and then reply on your own. It's kind of up to you how you want to do it.
Read them, I've talked enough.
Oh, also it just says I haven't shared the form. Sorry. I can't hear you, Emma. Oh, now I can. Hi.
Hello.
Sorry, did you say you wanted me to read it out?
Yeah, you read it.
Yeah, no problem at all. So how does it work with picking jobs? Oh, sorry. How does it work with picking jobs within the AU AUOAs? Is that the
academic unit of application?
Yeah. Do you pick a specific AFP speciality within the prospectus and gear your white space questions towards that? Or do you only rank the specialities once you have an AFP place within the UAOA? E.g., for Cambridge, did you focus on your white space questions, and interview towards critical care AFP, or kept it broad in the white space questions?
Okay, so the way it works is you apply to 2 academic units of application. Within each unit of application, you can apply to as many or as few rotations within that unit of application. So, for example, for Cambridge, I ranked the neurointensive care AFP, and there were 3 spots on that one. I ranked the neurosciences one, and I think I ranked the interventional neuroradiology one, which is, I think, option D or something. So I ranked 9 out of, I think, a possible 24. You can rank all 24, and that will maximise your chance of getting an AFP, but it depends if you want an AFP because you want an AFP, or you want an AFP because you want to research in a specific area, in which case you saw my answers. All I've really done in my, not all I've done in my life is neuro, but my CV is geared towards neuro because that's where my opportunities have arisen. And I think that's the same for all academic units of application. But obviously, if you don't have white spaces, you're just listing things that you've done. So with London, it doesn't really matter. And I applied to a lot more, or I ranked rather a lot more AFP programs within the London academic unit of application. I hope that's clear.
She says, thank you very much. That really clears it up. And then the next question is there a limit on the number of things that you can enter in a publications and posters section of the prizes section, or the prizes section?
There is. From memory, it's about 10 things per section, but I can't be sure, and it might change each year. But the limit is more than the number of points available. So list potentially 50 points worth, and they'll maybe give you 10 if you can, obviously.
Yeah, good advice. Thank you. The next question is, do you know whether other unit of applications outside of London do long listing with just the decile?
I don't know. I can only really speak from personal experience. I think London is the most aggressive in the way that it cuts down. But I don't know about sort of other big city programs like Birmingham or Manchester. So you just look it up either on the UK FPO website or just go onto the individual deanery websites. Sorry.
Oh, no, that was great. Thanks. How many times did you go through your white space questions before submission?
So many times. I sent them to the world and their wife. I sent them to my best friend's parents. I sent them to my mum. I sent them to my dad, who doesn't really even know where I am in the country at the moment. I sent them to my personal tutor. I sent them to my research supervisor, just because I didn't really have any idea of what they were looking for from me. And it is really hard to sell yourself in so few words. You want to be really careful with the exact words that you pick. So I can't even count the number of times. I was probably excessive, to be fair.
That's everything that we've had. We don't seem to have any more questions. So what I'm going to do is I'm going to post the feedback form one more time, just in case people forgot about it. But also maybe give a couple of seconds in case someone wants to ask. Oh yeah, here we go. Did Cambridge have a decile cutoff that you know of?
So Cambridge were so radio silent about how they picked from your white spaces. Obviously they had access to my decile and my score out of 50 that the UK FPO gave me. But it was complete radio silence. So if I could, I would tell you more information. I assume that they do. Because to read through someone's white space questions is a lot. But there's just no information. So I'd have to assume it's similar to London in that they only read, say, 200. I don't know how many even they interview. But they must cut it off. But I wouldn't say that you should let your decile stop you applying, because if a program's right for you, you will get it. And once you get to the interview, your decile seems to then matter less, especially with Cambridge, because they're just speaking to you as a person, and you have nothing to lose by applying. You'll only learn things about yourself and towards finals by applying.
Thanks. Another person said, thank you so much, Emma. Absolutely fab session. And then someone else said, thank you. Also, do the unit of application you apply to get access to your whole university transcript?
No, I don't think so. Unless anything is flagged up on your Oriel account. So they will only have access to what your university puts on Oriel about you. If you have some horrible fitness to practice issue, then that may well be on Oriel, because your university might think that's relevant, but they probably wouldn't do that to you unless they want to and request it from the university. But I'm sure that you may have to be informed about that. No. So that's why it's really important for you to sell your white space. If you don't tell them that you've been first or second decile every year, they won't know.
Fine. That makes sense. And the next one is, on the whitespace questions document, several deaneries have NA in each box, example Wessex. Does this mean they don't use whitespace questions for applications?
Yeah.
Okay, cool.
So then theirs will be more like London, but probably not as...
So London has none, right? It's just the 2 bits you said. That's everything we've got for the moment. So if anyone has any more questions, now's oh, I see another one. Where can you look up all the different AFP placements? I can't find a comprehensive list on Oriel, and on the AUOA websites, often they don't specify which research area the AFP is in.
Okay, so the way I did it, about this time last year on Oriel, even before they give you a login, you can kind of bypass that a bit. If you do group OP with a website, you just go to foundation programs, and then you can search through, and you can search through by AFP. When I did that, it gave me a comprehensive list, and I could filter by neuroscience AFPs, for example. But I actually looked on it for you guys the other day, and it was Oriel's going to a new site or something, and it seemed a bit different, and I don't really know how you guys can get around that. It is in the deanery's best interest for them to put it on their website, so it should be there. They should have a prospectus for each academic unit of application, but be aware that some deaneries don't give named AFPs. They don't have renal medicine AFPs. It may just be that deanery it just offers generic programs.
I think, yeah, this time I don't see any other ones popping up. Sorry, my cat is in a bit of a mood. I'll move out the way. But thank you so much for a really, really useful session. I had a lot of questions about AFP, and I feel like you answered almost, actually all of them. So thank you. And thanks for your details as well. I recommend to anyone who's watching this to defo email if you have any questions, because she's really awesome. So thanks.
Thank you, guys.
She says, or use Student Cube. Yeah, or use Student Cube. That's true. You can right there as well. Thanks. Bye-bye.